Chigo Cole Specialist Group, and then he has been my guest a couple of times now. Now we want to look at traditional bone setting. Um, you are an orthopedic surgeon, and then from my discussions with you outside, it does look as if a lot of people are brought in with complications from the traditional bone setting arena, and that is not good at all because now, of course, if we go around and see a lot of people with deformities and either they don't have the money to go to orthopedic hospitals after being badly treated in the traditional bone setting arena. So let's look at traditional bone setting. It's not as if, I mean, we are Africans. I mean, we all started from the traditional way,
Yes.
but science has opened our eyes to a lot of development. So let's look at that vis-a-vis the proper way of getting the bones to come back to life, and become functional again.
Yes, Chris, thank you very much. The practices of traditional bone setters really, really touching to me when I see their complications, which is more of the patients I see in Abulek. And you just tell the parents, this is what has happened, and this is this is the outcome is going to be, and they break down in tears. I saw an 8-year-old boy who apparently was driving his bicycle and fell and landed on his left forearm, and was rushed to a hospital somewhere in Lambe. And the guy, the traditional bone setter, actually claimed he's a doctor. Everybody calls him doctor, doctor. And the first thing they did was just put a bamboo splint, tie the hand. Unfortunately, it was too tight. Forehand that could have just been managed with a simple POP backslap. And the boy went home and he was crying all night. The mother couldn't take it. Had to rush down to a hospital closer to that axis, the Jew axis, and the doctor saw and took down the bamboo. But unfortunately, the hand has already suffered irreversible damage, what we call the Volksman ischemic contracture. And that's not even the problem. The fracture was malunited. By the time I was called to see, the boy's hand was like a withered hand.
Okay.
It was like a withered hand. I told the mother the consequences and the outcome of whatever treatment, and they are hopeful. The surgery was done, and the boy is still under care. I also saw another 1 month, 6-month-old child who, at 1 month, fell off the mother's hand on the bed, and they rushed to a woman who says she's a traditional bone setter, and they tied the hand till today. That hand is permanently deformed. I had to send to the plastic team in Igbobi where I trained, and I've been doing a lot of follow-up because I know this kind of care should be that of institutionalized. The child is still going to grow, and it's a female child. Talk of bright price, deformity the child didn't bring into the world is there now, and the child didn't bring it. And these parents can't even make trouble because they tell them, we'll kill you with Ifa, we'll kill you with Shango, we'll kill you with Ogun, and they don't even want to discuss about them or their location or anything. I'm not here to castigate them. What I'm here to do is even to partner with them. There was a time in the early 90s, National Orthopedic Hospital Igbobi, actually, when we've seen a lot of their complications, we try to get to their decision and invite them and train them, 3 months training on simple fracture management, and give them certificate of...
Hold on. Hello there. Good morning. Please, could you turn down the volume? Yeah, what's that? No, you will get it from the producer. It's not ethical. You will get it from the station. We'll give you the station's number. You will call, and they will then give you his number. Yeah, then they will now give you his number. It's not ethical. I can't release his number like that, right?
Yes, that's the right thing.
At the end, beautiful. At the end of the program. Thank you, sir. Yes, sir. Thank you for calling now.
So,
do call us and join the discussion. I'm here with Dr. Cole, Dr. Chigozie Eze, Dr. Bone. He's of Chigo Cole Specialist Hospital. and then we're discussing traditional bone setting. Call us 0906 000 3352, 0907 132 9563, and join in the discussion. And then whatever problems you have, all we're trying to do is to bring out the facts. Dr. Bone, in the 90s, I remember during the Baby Friendly Hospital Initiative, traditional birth attendants were actually adding to the number of maternal mortality in Nigeria, and it was so high. And then, but the Lagos State government had started